Chances are, you've got one of these in your medicine cabinet right now, but you probably don't realize that it's actually a tiny, super smart healing machine. Today, we're going to pull back the curtain and look at the seriously sophisticated science packed into the modern bandage.
You know those pimple patches that are everywhere now? Or those amazing blister bandages you slap on after a long hike? If you've ever used one and seen it turn all white and puffy, then you've actually seen this science in action. But what is really happening under there? Let me tell you, it's not just a cover. It's an active healing environment being created right before your eyes.
So what's the secret sauce here? Well, it's a material called a hydrocolloid, and its power comes from a really clever two-layer design.
Okay, so what is a hydrocolloid dressing? Basically, think of it as this self-sticking bandage that's just packed with these special little particles. Now, when these particles come into contact with the natural fluid from a wound, they do something incredible. They transform into a gel, creating this perfect, moist little bubble for your body to heal itself.
And the way it's built is just genius. It's all about these two layers. The inner layer, the part that actually touches your skin, has what are called hydrophilic particles. That's just a fancy way of saying water-loving. When they meet fluid, they just soak it right up. Then you've got the outer layer, which is like a tiny bodyguard. It's a waterproof but breathable film that keeps all the nasty bacteria out but still lets the wound breathe.
Okay, so we've got the two layers, right? But how does that actually heal anything? This is where the magic really happens. It's all about the gel.
The whole process is so simple, but it's incredibly effective. Here's how it goes down. The moment the bandage touches the wound fluid, doctors have a term for it, they call it exudate. Those hydrocolloid particles kick into gear and start absorbing it. They swell up and transform into that soft, protective gel, basically creating the perfect little sealed-off world for your body to start its repairs. And this gel, it's not just sitting there. It's an active player in the healing game. By keeping the wound moist, it helps new skin cells move in faster. It also helps with something called Autolytic debridement, which is the body's awesome natural way of clearing out dead tissue all on its own. On top of that, the gel cushions the nerve endings to make it hurt less, and it keeps the temperature nice and stable, which is just what healing cells love.
Now, as amazing as this all sounds, you can't just slap a hydrocolloid on any old cut and scrape. These dressings truly shine. I mean, they are superstars, but only in specific situations.
So where do they work best? Well, they're fantastic for those wounds with just a little bit of fluid. We're talking scrapes, certain minor burns, or even the places where skin grafts are taken from. They're also a total go-to for those early-stage pressure sores, bed sores. And they can even be used to help soften up dry, gunky wounds so the body can clean them out. And of course, they are perfect for protecting places that get a ton of rubbing, like your heels.
Okay, let's pause here, because this next part is super important. Using this dressing on the wrong kind of wound, it's not just a bad idea. It can actually be dangerous. Let's look at when you should absolutely not reach for a hydrocolloid bandage.
And here's the crazy part. The very thing that makes them so great, locking in all that moisture, is exactly what makes them a terrible choice for certain injuries. First rule, absolutely never ever put one on an infected wound. That's like creating a perfect little greenhouse for bacteria to thrive. You don't want that. Same goes for really deep wounds or wounds that are draining a lot. The bandage just can't handle it and will get overwhelmed. And for very serious stuff like deep burns or dry gangrene, that sealed, low-oxygen environment can actually encourage the growth of dangerous anaerobic bacteria. Those are the kind that love places with no oxygen.
All right, so now that we know where they work and where they're a definite no-go, let's wrap this up with a few pro tips and the big takeaways.
One of the coolest things about these, how long you can wear them. You know how you change a regular Band-Aid every day? Forget that. A hydrocolloid can often stay put for 3, 5, sometimes even up to 7 days. That means you're not bothering the healing wound as often, and hey, it's also really convenient and saves you money.
Okay, this is probably the #1 thing that freaks people out. When you finally take the dressing off, you're going to see this yellowish, kind of gooey substance, and it might have a bit of a smell. It is so easy to look at that and think, oh no, it's infected. But it's not. That is just the hydrocolloid particles, all mixed up with the wound fluid. It's the healing gel. It's actually a sign that the bandage is doing exactly what it's supposed to do. So what's the final word here? Hydrocolloid dressings are an absolutely powerful, super effective tool, but only for the right wound at the right time. They aren't some magic cure-all, but when you use them correctly, they create this incredible environment to let your body do what it does best, heal itself.
So, that simple bandage on the pharmacy shelf, A lot more advanced than you thought, huh? The next time you see a blister patch or a pimple patch, you'll know it's not just a sticker. It's a tiny, self-contained bioreactor, cleverly designed to work with your body. It kind of makes you wonder, what other everyday things are hiding some seriously cool science right under our noses?